नमस्कार दोस्तों, आपका स्वागत है मेरे YouTube चैनल निर्जा होमियो गाइड में। और मैं आपके साथ डॉक्टर ज्योत्सना सिंह विथ AIPGT 2017 क्वेश्चन पेपर। Rapid urease test in case of peptic ulcer is done for the diagnosis of infection with Helicobacter pylori. Next, all of the following are the cause of clubbing except. So, clubbing is a physical sign characterized by bulbous changes and diffuse enlargement of terminal phalanges of fingers and toes. So, option is non-small cell lung cancer, fibrosing lung disease, iron deficiency anemia, subacute bacterial endocarditis. So, iron deficiency anemia is not the cause of clubbing. To remember the cause of clubbing, here the chart is given. Next, which of the following is not a true statement with respect to chronic disease? Option A, disturbance of calcium and phosphate metabolism are almost universal in advanced stage. So this is true statement. Urea and creatinine are raised. Yes, this is also a true statement. Anemia is a rare phenomenon. No, this is not a true statement because anemia is a common in this chronic kidney disease. And last option is hypertension and diabetes mellitus are one of the common cause. Yes. Next question. Match the following. So here the signs are given. First is Kuhnke's sign. It means capillary pulsation in nail bed. Dergier's sign, that is femoral bruit, and de Musset sign, that is head nodding with pulse. So the correct answer will be the next. Which of the following statement is false regarding sickle cell anemia? One, autosomal dominant inheritance. This is the false statement. Next, painful vaso-occlusive crisis. True. Electrophoresis demonstrates the predominance of HB. True. Splenic infarction is true. So the correct answer is the first one. Which of the following is not a feature of nephritic syndrome? The feature is the oliguria, which causes hematuria. Next is the edema. Third one is the hypertension. Next, fever, weakness and fatigue. Next is the vomiting with abdominal pain. And the next is the malaise. So now we can see the option given is hematuria. Okay, this is the feature. Polyuria, no, this is not the feature of nephritic syndrome because oliguria is a feature. Edema, right. Hypertension, right. Next is the match the following. So this seems that there is deficiencies given. Vitamin A deficiency causes Bitot spots or Bitot spots. Vitamin B12 deficiency causes subacute degeneration of the spinal cord. Deficiency of thiamine causes Korsakoff psychosis, and the deficiency of niacin causes casus necklace dermatitis. So answer will be the next question. All of the following are the features of lepromatous leprosy except. So option 1, widespread nodules and infiltration. Option 2, loss of eyebrows. Option 3, late nerve enlargement and damage. And option 4, zero bacterial index. So above all three are the features of lepromatous leprosy except the zero bacterial index. So answer will be the D. Next question, tropical pulmonary eosinophilia is caused by. So it is caused by the Wuchereria bancrofti. Next question, which of the following is a major manifestation under John's criteria for the diagnosis of the rheumatic fever? Here it is asking the major manifestation under John's criteria. So we should know that under John's criteria there is two manifestation or criteria, major criteria or minor criteria. The major criteria, it comes migratory polyarthritis, Sydenham's chorea, subcutaneous nodules or erythema marginatum. And under minor criteria, there is fever, arthralgia, in lab elevated acute phase reactants or prolonged PR interval. So we can see this chart by which we can differentiate the major and minor criteria. So options are given: fever, which is under minor criteria; rage, yes, are minor criteria; leukocytosis is also under minor criteria; erythema marginatum, that is major manifestation under Jones criteria. So answer will be the D. All of the following are features of lower motor neuron disorder except. Option given is the fasciculation, flaccidity, spasticity, muscle wasting. So spasticity is the feature of upper motor neuron disorder. Okay, and above all three, fasciculation, flaccidity and muscle wasting is the feature of lower motor neuron disorder. So answer will be the spasticity. Exclamation mark here are pathognomonic sign of. Answer will be alopecia areata. Next question: which of the following are the features of menopause? A. Secum FSH and LH is more than 40 MIU per ml for 300 consecutive values at weekly interval. B. Vaginal cytology showing the maturation index of at least 10:85:5, suggestive of low estrogen. C. Serum estradiol is less than 20 pg per ml. So all three options are the features of menopause. So answer will be fourth option, A, B and C. Which of the following is invariably the primary site of pelvic tuberculosis? Answer will be the fallopian tube. Next question: retrograde menstruation is a feature of. Answer is the endometriosis. Next question: which of the following is not a feature of polycystic ovarian syndrome? Anovulation, yes, it is the feature. Hyperandrogenism, this is also a feature of polycystic ovarian syndrome. Decreased LH is to FSH ratio, no, this is wrong, this is not the feature. There should be increased LH is to FSH ratio in PCOS. And last option: more than 12 peripherally arranged cysts in ovaries on sonography, yes, it is the feature. So answer will be the C, decreased LH is to FSH ratio. Next, a 32-year-old multipara present with 32 weeks gestation, mild vaginal bleeding and abdominal pain. On examination, her blood pressure was 150/100 mmHg, abdomen was tense, tender and hard. Fetal heart sounds are not audible. On examination, placenta was not felt in lower segment. The most likely diagnosis is. Option given is placenta previa. This is a painless bleeding. Uterus relaxed, soft, elastic, without tenderness. FSH is usually present, so this is not the answer. Abruptio placenta, yes, this is the answer of this question. Is the regular uterine contraction with or without pain or dilatation and efficient of cervix, pelvic pressure, backache, vaginal discharge or bleeding. Other option is pyelonephritis. It is the inflammation of kidney due to a specific type of UTI infection during pregnancy. So answer will be the abruptio placenta. Which of the following is a feature of healing by secondary intention? So in the given option, answer is healing by granulation, contraction and epithelialization is a feature of healing by secondary intention. Next question: a 28-year-old male present with a discharging opening in the natal cleft overlying the coccyx. On examination, hair were also seen projecting from the sinus, and most likely diagnosis is. So here we can see the keyword is On examination, hairs are seen projecting from the sinus. So in hemorrhoid, no. Anal fissure, there no. Pilonidal sinus. Yes, this is the answer of the above question. And the other option is given is the hyaridinitis suppurativa. This is a type of acne in versa, means lump in armpit or the groin. So answer will be the C, pilonidal sinus. Next question, a 40-year male present with sudden onset of epigastric pain radiating to back with repeated vomiting and hiccups. On examination, pulse was 100 per minute, blood pressure 90 by 60 mm of Hg, and bluish discoloration of flanks and umbilicus. The abdomen was distended and tender. Which blood investigation should be performed in this case to confirm acute pancreatitis? So simple, the question is asked that in acute pancreatitis, which blood investigation should be performed to confirm this disease? Option given is troponin, which is for myocardial infarction. Creatinine phosphokinase test is also for myocardial infarction. Acid phosphatase is for carcinoma in prostate. So answer will be serum amylase. Next, a 40-year-old male complains of regurgitation of saliva and ingested but undigested food. A barium radiograph reveals a bird beak deformity in distal esophagus. What is a probable diagnosis? All are having a regurgitation in digested food. Key word, bird's beak deformity in the barium radiograph. So this type of deformity is seen in achalasia cardia. So answer will be achalasia cardia. We can see the other option, that how to differentiate. Next is a pyloric stenosis, in which there is also vomiting, epigastric pain, foul smelling, irritation, but in barium meal X-ray, a marked dilatation of stomach is seen. Itis hernia, regurgitation, chest pain, or respiratory distress, but in barium meal X-ray of esophagus, stomach will reveal the hernia. Okay. Which of the following hernias follow the path of spermatic cord within the cremasteric muscles? So answer will be indirect inguinal hernia. Next question, a 40-year-old smoker present with pain in right lower limb aggravated on walking and feels better by rest. On examination, limbs become pale on elevation and changes to red when the limb is allowed to hang down. The pulsation in right dorsalis pedis and the posterior tibial artery were not felt. So what is the most probable diagnosis? And symptoms, that pain in right lower limb which is aggravated by walking and better by rest. Next symptom is the limbs become pale on elevation and change to red. There is also a poor pulsation felt in the right dorsalis pedis and posterior tibial artery. All these symptoms match to the disease peripheral vascular disease. So answer will be the peripheral vascular disease. Which of the following statement is not the feature of Fallot's tetralogy? No, what are the features of Fallot's tetralogy? Tetra means 4, so there are 4 features of Fallot's. First one, non-restrictive VSD. Second, overriding of aorta. Third, pulmonary stenosis, and fourth one is the right ventricular hypertrophy. So in the given option, we can see overriding of aorta. Okay, it is a characteristic point of Fallot's tetralogy. Pulmonary stenosis, which is also a feature. Right ventricular hypertrophy, which is also a feature of Fallot's tetralogy. So which one is left? Atrial septal defect. This is not a feature of Fallot's tetralogy. So answer will be A. ASD. Next, all are the components of acute inflammation except. तो acute inflammation के components हैं, first one is the dilatation of small vessels, yes. Liberation of cytokinesis, yes, it is the component of acute inflammation. Next is decreased permeability of microvasculature. No, there should be increased permeability of microvasculature. So this is not the component of acute inflammation. Decrease नहीं होगा, increase होगा. And then last one is the emigration of the leukocytes from microcirculation. So this is also the component of acute inflammation. Answer will be C.